Hey everyone, welcome to Biohack Your Body, the show that focuses on increasing longevity, health span, and optimizing performance. I'm your host, Dr. Bashima Williams, family practice doctor for almost 30 years and functional medicine expert. If you like what you hear on today's show and want to learn more, go to beingfunctional.com. That's being, B-E-I-N-G, functional.com, or follow me on Instagram. Doctors, DOCTORS underscore being functional. We'd love to hear from you there. We have a special guest on today's show, and actually, he'll be a regular because, and in full disclosure, he is my husband, Dr. Michael Williams. Dr. Mike and I have been practicing medicine together. We met in medical school, so we've really been practicing medicine together kind of ever since we've been practicing. Right, Mike? Thank you so much for being
Sure.
on this show, Mike.
Thank you. Thank you for inviting me back again. You're doing a great job on your show.
Oh, thank you so much. You're so sweet. Well, Dr. Mike owns and operates Ultra Wellness Medical in O'Fallon, Missouri. If you want to get a hold of him there, if you like what you hear today, you can reach their office at 636-333-9820. That's 636-333-9820. Or you can go to ultrawellnessmedical.com and find them online and learn about all the wonderful things that him and his office and staff. You have an amazing staff, by the way. I love Denise and Stephanie and everyone there and all the, not only regular medicine that you do, but a lot of preventative medicine that you do. And today we're going to actually talk about a very important topic, and that is all about weight loss. So
Yes.
I would like to know, I'm going to kind of
Demystifying
give
weight
you
loss.
yeah, I'm going to give you the floor and just really tell me about the epidemic we're seeing right now in obesity. And more importantly, when we talk about obesity, we're not just talking about how you look and can't get into your nice tight jeans. We're actually talking about much more important, deeper issues. So I'm going to give you the floor. Just kind of tell me about what you're seeing in your practice.
Well, I think it's common, right, as baby boomers are getting older. I mean, it's estimated that we're going to have um, like over 40% of our population will be over 65, but along with that comes chronic disease. And definitely the biggest thing that we see as a cause for chronic disease has been obesity. And obesity leads to obviously diabetes, high blood pressure, heart disease, stroke, arthritis, just really impairing someone's quality of life when they're more obese. And I think everyone knows that when you look at, we know that as a society, particularly in America, we're more of an obese society. We put on more weight. We're heavier than we've ever been. And I think you see that when you look at pictures back in the 1950s and 1960s, and you see all these people walking around and they're thin and you don't and it's harder to see someone who's overweight, and now it's becoming more of an issue that we see that people in general are heavier. Some of the statistics have been like, I think over the last, since the 1970s, we've had like a threefold increase, of obesity, compared to just the 1970s. So it's definitely an epidemic that we see. And it's difficult because a lot of it's our lifestyle and it's the food we eat, right? That's probably the biggest thing. We've gone from a society where people ate protein, they eat vegetables, they eat more whole foods, to my society when I grew up in the 70s, born in the 1970s, where processed food, packaged convenience type food became the standard. And so that's where we're at today as a result of all of that. Fast food, convenience food, food that tastes good but has a lot of calories for a small portion, just high calorie dense food. We're in a situation now where we have an epidemic of obesity, which is going to lead to chronic disease long term and decrease longevity and healthy lifestyle.
Yeah, and in particular, corn syrup, particularly the high fructose corn syrup, that's been implicated in contributing to obesity since the 1970s when we started to see more widespread use. The high fructose corn syrup became popular, especially in the food and beverage industry, because it was cheaper than table sugar and had a longer shelf life. And so the whole processed food world and sugary drinks world began.
Right.
And we now have the consequences of a standard American diet in seeing obesity numbers like we have never seen before.
Right. Well, we used to, and interesting too, a popular diet when I was a kid was like the low fat diet, right? So it really didn't, people would just eat sugar, right? As long as they were not eating fat, you could eat as many carbs as you want and eat sugary stuff. That wasn't the problem. It was just don't eat fat. And as a result, there's just been a lot of changes and people have grown up in cultural eating patterns, traditional eating patterns, just a lot of misconception that people have developed bad habits and food tastes good. And as a result, we're in this process now of trying to, how do we turn the tide on that? And how do we, get the weight that's been put on off and maintain a healthy lifestyle for the long term?
Yeah, I'm always weary about any new diets or any new diet fads because, there was the low fat diet, the sugar-free diet, and then there's also all of these other diets, the keto diet, the paleo diet, all of these diets. But really, what we teach in our Feel Good Gut Health course, which we have had hundreds of people go through, is eating an anti-inflammatory normal food, normal, nothing weird. And we're certainly not completely restricting certain things because that really puts us in this food prison where we're not allowed to have certain things, even on special occasions. And that's going to be really restrictive and too hard for people. So we really teach people how to eat an anti-inflammatory diet most of the time. And you and I have walked hundreds of people through weight loss. And what we really want to do is, while we're helping them with weight loss, with and without medications, what we really want to focus on is having a mindset change and which then leads to a behavioral change. And the opposite is true when we eat foods that are sort of bad for us, let's say a piece of chocolate cake, that sudden spike in blood sugar then causes that fatigue, then causes us to sit on a couch and watch TV the rest of the night versus eating a healthy dinner, stopping snacking after dinner, no snacks, no late night snacks, maybe going on a walk after dinner has this nice blood sugar lowering effect. And that actually is energy giving and it's energizing. So you can actually be productive mentally and physically. So really important to correlate the obesity is more than just a few extra pounds. It's actually one of the leading causes of the non-alcoholic liver cirrhosis. Mike, when you and I started medical school, we saw more alcoholics with liver cirrhosis than now. What we're seeing is mostly obese people that have a lot of fat stored in their liver. Has that been your experience also?
Yeah, I think that's a common kind of epidemic that we see today, right? Is issues with we call it metabolic syndrome. Just people with, obesity and with fatty liver changes. The liver is a big organ that processes blood sugar and cholesterol and detoxifies vitamins and minerals and medications. And so now we see people who it's not uncommon to see someone who has mildly elevated liver enzymes, ultrasound or some type of imaging shows fatty liver changes, and they don't even drink. So that, it's not an issue that they're an alcoholic. But then if you add that on top of it, obviously that even becomes more of an issue and more damage can be done. So that's the biggest thing we're trying to work on is what can we do to help people turn the tide? What can we do to help them lose weight, get their weight down, but then not do some kind of a crazy diet or a fad diet that they're not going to be able to maintain, but make lifestyle changes that they can lose weight, um, get into a better pattern and make better choices, be on a normal diet that they can live for the rest of their life, but then, also just be able to maintain that weight loss. And, what can we do to start the process to kind of jumpstart that so they can have long-term success?
Yeah, and Feel Good Gut Health, and you can look up feelgoodguthealth.com. We start with mindset. If you don't change the mind, because it literally controls everything else, right? So if you don't make this conscious
Right.
decision, then you end up being in that statistic. For example, 60 to 70% of people who are obese have non-alcohol related fatty liver disease. That's a really big deal because the liver is super important for detox and everything else. So when we get back from our break coming up here, what I would love to hear is, say a person who has obesity is listening to this, wants your help and your expertise. So what I want is to imagine this person calling your office, making an appointment, coming in, and I would love to hear what they could expect. And if you want to call Mike's office, it's 636-333-9820, and we'll be right back after this break and pick up there. All right, our next timer, Mike, is 8 minutes and 40 seconds. So let's go ahead and reset it. And I'm going to go ahead and start. You ready?
Mm-hmm.
You got your timer set?
Yeah.
All right, and here we go. Welcome back, everyone, to Biohack Your Body show. I'm your host, Dr. Bashima Williams, and been practicing medicine for almost 30 years. And with me today is my husband, who's also, we met in medical school, so we've been practicing medicine almost, well, pretty much the same exact amount of time, right? Right, Mike?
Right. Right. Graduated the same year.
Yeah. So before we left on break, I had talked about what does it look like for a patient to actually walk into your office and get the medical care that they need if they're suffering from obesity, especially now that we've sort of outlined in the first part of the show why obesity again. It's not a vain issue. It's not a issue of I want to fit into these tiny jeans. It's actually a metabolic issue, which when we have metabolic illness, which means our body's not metabolically working like it's supposed to at the cellular level, and obesity is a common cause of that, then of course we buy other products, hypertension, heart disease, cancers, all sorts of things that are unlocked
Mhm.
because of this obesity that we have. So
Right.
can you tell me what, so say I call your office, 636-333-9820. Hey, Dr. Mike, can I make an appointment? Kind of walk me through what step by step what a person should expect.
So part of our practice was definitely doing weight loss. So we're not only a weight loss clinic, but that was a part of the practice when we started it because it's the start of a lot of chronic issues. So if you have a practice and you're just simply treating high blood pressure with a medication or, diabetes with a medication. And oftentimes those are needed, right? Those are things that we have to do to get a situation under control because we know that uncontrolled hypertension and diabetes and stuff lead to even worsening medical issues and chronic problems. But that was a part of the practice to work with individuals to lose weight, to hopefully make long-term lifestyle changes, with the goal being that we improve someone's longevity, not just their lifespan, but their healthy life and their vitality as they get older. And so, in our office, we do see patients for medical weight loss and for consults, and really what that entails is getting a good history. So it's getting a good history on them, what kind of medical problems they have right now. We want to look too at their goals. So we're always looking at, what is someone's goals? Because for some people, it's just maybe losing 20, 30 pounds, maybe not being perfect weight. Other people want to get down to more of an ideal body weight. And so we're wanting to look at that. We're always looking at some lab work, things that they may have had recently, because there's definitely some just basic metabolic things that we want to look at. We want to make sure that someone's thyroid is within normal range. We want to make sure that their vitamin levels, sometimes hormones as well, electrolytes and even cholesterol, blood sugar, just kind of get a sense of where that's all at. So we know what baseline we're starting with. And then in our office, we use the medications, some of the medications, the injectable medications called GLP-1 agonists. And so those medications go by the name of the generic name of semaglutide, which is Wegovy Ozempic is the brand name, and then tirzepatide, which is Mounjaro and Zepbound. And so those medications we can get into a little bit more, but we use those medications to help really turn off food noise, decrease appetite. People get a quicker sense of fullness and what we call satiety. And in doing that, the goal is then hopefully putting them on an eating plan. And we're preferential to the Mediterranean diet because really when you look at just data on all kinds of diets, there's hundreds of diets out there ranging from, like we talked about earlier, low fat diet to keto diet to South Beach diet. But Mediterranean diet's really more whole foods. So we really want someone look to eat more whole foods. And oftentimes people describe that as shopping the outside of the grocery store, so staying away from all the processed stuff, pulling back on sugars and sugary drinks, and really eating lean protein, vegetables, some carbohydrates, nuts, olive oil, some fruits, and getting into that pattern with hopefully the help of the medication to help them take away some of the food cravings, decrease the cravings, and lower the appetite, and give more of a sense of fullness so people are able to cut back their portions, and then also just be able to make habits. So it takes a long time, it takes months to get new habits. So break some bad habits, get into good habits, that then hopefully with the medication or with those medications, they can get better and maintain their weight when they've lost it and be in a better pattern and not be on the medications long term. And then there's also other medications, and there's also different supplements, and there's different things that we can also look at. But truthfully, the best data today that we have been the GLP-1 agonists that can be beneficial.
So just to kind of get into what, the GLP, and also there's another one, right? The GIP, the GLP combination.
Mhm.
GLP is the glucagon-like peptides. Now, these peptides, so just so everyone knows, peptides are amino acids that are grouped together in a certain position that make up something called a peptide. And when you put a whole bunch of peptides together, then you get proteins. So this is just literally something that your body makes. But when we're giving it or prescribing it in a prescription, we're giving a little more. And the glucagon-like peptide, it's produced in the intestines in response to you eating anyway. And this
Right.
this goes back to the course Feel Good Gut Health. One of the things that we really preach in Feel Good Gut Health is healing your gut. That's why we call it Feel Good Gut Health. It's actually a nutrition course, but we also talk about leaky gut, some mindset things, and things of that nature. But with a healthier gut, you can make more of your own natural GLP-1s on your own. It does help regulate blood sugar levels by promoting insulin secretion from the pancreas and inhibiting glucagon, which is the glucose. It's what makes your liver make glucose. It inhibits that as well. So literally, it does a really beautiful job naturally at stabilizing blood sugars. Now,
Right.
there's another one called the gastric inhibitory peptide, also known as the GIP. So there's another subset of medications that we use frequently that are called the GLP GIP combo, like Zepbound or Wegovy. Zepbound or Manjaro.
Mhm.
And those are
Right.
also equally as, very effective and very good. But, one thing I don't do personally in my practice, and I know you don't either, is we don't just put people on these medications. One of the reasons, again, we created this course is because we wanted people to have what it takes. No one wants to be overweight. No one wants to be obese. No one wants to be tired all the time. No one wants diabetes and cancer and all these other things that stem from having a poor diet and many poor lifestyle choices. We want to be healthy. We want to be able to grow old, play with our grandkids, travel, do whatever else we want to do, but yet we're eating in a way that's not going to help us reach our goals. So when we get back, we're going to discuss that a little bit more. But I do want to shout out to darkbags.com for sponsoring us. And I really appreciate all the amazing products that they give us, like this beanie that really helps protect us against EMF. So when we get back, we'll pick up right where we left off. That was perfect timing. Okay, the next one is 13 minutes and 40 seconds. So just 13.
Okay. You tell me when.
I sure will. 3, 2, 1, let's go. Welcome back, everyone, to Biohack Your Body Show. I'm your host, Dr. Bashima Williams, Biohack Your Body. Here we focus on increasing health span. We want to be healthy. We want to live healthy, productive, functional lives, hopefully until just before the day we die. So we want to really be functional. Like for me, I want to be hiking until, maybe a week before I die. That'd be pretty awesome. I don't want to be tired. I don't want to be, I don't want to be tired. I don't want to be told I can't go travel or do something like that. So
Right.
if that resonates with you, you're listening to the right show. And today we are talking about all things associated with obesity, the horrible ramifications of having obesity, and the amazing tools that we now have in our practice, both of us, being functional and Ultra Wellness Medical, that really helps combat that. And I would say pretty efficiently as well. This has been something that I personally have helped patients with over, almost 30 years actually. And it's been something I've been very, very passionate about. When I went through menopause, during COVID, I actually gained a lot of weight because I suddenly became insulin resistant due to lack of estrogen. And that's something that I knew about, but I didn't have personal experience with until I actually went through it. Of course, mine was combined with not having a gym to go to anymore, the stress of COVID, having teenagers at home, all that stuff. Still, I should have had more self-awareness of going through menopause and of the increase in insulin resistance that is associated with it. And when you are insulin resistant, it is super easy to gain weight. Trust me, I was there, been there, done that. I had to lose weight on my own. And I, really did it the old-fashioned way. And that kind of was the whole reason I created Feel Good Gut Health, is to sort of show everyone what I learned, what I did in my own life to heal my gut and heal and also have the weight loss. Took me a couple of years to lose the weight, get back to normal, get back on my hormones, do all that stuff. But trust me, if I can do it, anybody can. But you have to get your mind right. You have to decide what you're going to do. 95% of what we do day in, day out is subconsciously done. We need to take inventory of what we're doing. We need to understand why we're doing it. And so we have handouts and worksheets and things like that with Feel Good Gut Health that we have people go through, including personality testing, because we want you to understand what your strengths are personality wise, and how you can best break those habits that have been controlling your life and literally making you make decisions that lead to poor behavioral decisions regarding your diet and what you take in. So in addition to uh, I remember, Mike, when you were opening up your practice, one of the things you did is you actually purchased a green emerald laser machine that actually helps patients, burn fat with a laser. And I remember one of the reasons you spent all that money, you had to have this laser, is because of your knowledge, for a long time, because we've seen patients for a long time, because of your knowledge of seeing what obesity does to patients. And I just loved that about you. I loved that you invested in your company, and I loved that you invested in your patients. And I love that you were doing all that research on how you can help your patients the best. So tell me what else patients can expect. I know that if they're in menopause, you're going to treat that. If they're, so many things. So tell me what else patients can expect to see in your practice.
Well, I think the biggest thing I just kind of focusing a little bit more on the medication, the injectables. I know we kind of ran through that quickly, and I guess just some concerns that sometimes I alleviate with patients. There's sometimes, obviously no one is deficient in those medications. It's not a vitamin that's a nutrient deficiency. So it's not to say that, we just want to simply throw a injectable medication at somebody because that's the only way they're going to lose weight. And if they don't have it, they're never going to lose weight. It's a tool in the tool basket, just like lots of things that we have. And so that's been probably the big, like you, as you mentioned earlier, alluded to, that's been the biggest game changer for us. And really those medications, if done in the appropriate setting, are very safe. There's a lot of bad kind of maybe publicity about it, or just simply going on a medication. People have made comments like Ozempic face, or losing weight too much. And in any case, if someone loses weight rapidly or in not a good manner, then there can be some side effects. People can have, muscle loss and some bone loss, and but in the setting where you're under the care of a medical director or medical provider, and in the setting where you are eating healthy, you're getting enough protein, you're getting vitamins and nutrients, you're exercising, those are all keys with it. So anytime of weight loss, someone can lose weight loss if they just don't eat all day. You could eat a banana for breakfast and a peanut butter and jelly sandwich for lunch and cereal for dinner and lose weight, but that's pretty unhealthy and you're not getting any protein and you're going to have some issues. So in the right setting, those medications really can be beneficial at decreasing appetite. They really do turn off some of the food noise. That's probably been one of the biggest things that's been interesting about those medications and using them is it really, people will mention that they don't feel like drinking. It turns off some of their cravings maybe for alcohol. It'll turn off someone who's drinking a ton of soda will just feel like they just don't want to drink as much soda, or someone that has like this, they want to just snack at night. It not only kind of decreases their appetite, so they're not as hungry, but it also will turn some of that stuff off from a central perspective in the brain. And then not, you can't really discuss this as far as making promises, but we see that those medications tend to have some anti-inflammatory properties. And that's more anecdotal just from people talking about it a little bit in the way the mechanism works. They're not anti-inflammatory meds per se, but I've had patients with autoimmune conditions like rheumatoid arthritis very quickly, like in the first month, say before they've really lost a lot of weight or had huge dietary changes, say that those medications have made their joint aches and their muscle and inflammation in their body markedly improved, better than some of the biologic medications, some of the other prescription medications they were on specifically for like rheumatoid arthritis or the arthritis that they were being prescribed for. So I think that's been a key. And then in really close follow-up with patients, trying to giving them the lowest effective dose, and monitoring their progress as they go through, and then constantly trying to give them some reassurance, trying to tweak things, being an accountability partner for them, in regards to that. And so some of the data that we see in regards to when we look at the generics, again, the semaglutide, which is Ozempic, and Wegovy, and tirzepatide, which is Mounjaro, which is the diabetic prescription, and then Zepbound for weight loss. In about most of those studies, people will see for the semaglutide, about a 14 to 15% reduction in body fat over about 70 weeks. Tirzepatide, people will see about 21% over that same period. So it can be a significant amount of weight, but that's also in the setting of taking some time. Those are periods of time that are over a year. So that's not something you're going to see, obviously, in a couple months. We like to see a consistent weight loss of about a pound a week, anywhere from a pound to 2 pounds a week. And so sometimes early on, people will have, 2 pounds a week. They'll have a pretty good weight loss in the first month or couple months. And then it obviously slows down as you lose weight. So you want it to be done naturally, over a period of time. Just some other things we have in our office, you mentioned the Emerald laser, and the Emerald laser is an FDA approved laser that actually that's more for targeted weight loss. So like in the abdomen or the hip, thighs, really how that works. It's what we call a cold laser. It's putting energy. It's at 532 nanometers, a specific wavelength, which is green light. And that puts energy into the tissue, and in particular in the fat cells, and causes some little micropores to develop, which causes some of the fatty acid and the fat inside the adipocyte, the fat cell, to leak out and be picked up by the lymphatic system to be used as energy. And so that will cause some shrinkage of the fat cells. And then if people are maintaining a healthy diet and not overeating, that fat cell will stay down. It'll cause some shrinkage of those fat cells. It's not killing them, and it's not causing like disfiguration where you burn or you freeze the fat cell, which then could cause scarring and have some lumpy, bumpy areas. So that's just another tool in the tool basket that can be used, and it works great in combination with weight loss to kind of help accelerate that. And in the studies, there were some Harvard, some Mayo Clinic studies and some placebo control where they had people actually getting the laser and other people not using the laser. They were getting kind of just a green light. And they saw in the studies um, between the hips, the abdomen, and the waist. So those three areas, after 8 sessions, so over a month, there was about a 6% or 6 inch rather reduction in the circumference, the diameter in those areas. So not each area is 6 inches, but combined. So and those are in patients that were not trying to diet. So actually in that study, they were told to just eat your normal diet and don't make any changes, don't exercise more. Let's see just what the laser. So that in theory is just what the laser was able to do. And the placebo controlled, so the group that wasn't getting the laser, that was just getting green light, lost something like 0.7% or zero point 0.7 inches rather. So those were some good studies with it. We also combined one other thing with it. So we kind of combined sometimes a package together with the weight loss, medication and follow up along with the emerald laser, but also one called the Star Former, which is a electromagnetic device that does muscle contraction. So that can be used on the abdomen, for example. Same thing, abdomen, buttocks, gluteal areas. And that's just cause it's a muscle toning. So it's doing thousands of muscle contractions um, and just tightening the core. So tightening the core abdominal muscles. And that again is it's done once or twice a week over 6 to 8 treatments, just depending on what someone wants to do. So all those in combination really can help, not only cause, overall weight loss, which is our goal, and getting someone into a healthy lifestyle, but then also doing more targeted areas, where sometimes it's harder to lose fat and lose inches.
Yeah, that's all pretty impressive. And also, you also have a body composition scanner that you can also actually prove because the biggest problem with these injectables are people are losing a lot of muscle and they're not losing a ton of fat. In fact, in some cases, they might even be gaining some fat while they're losing muscle. And the biggest problem, this is the reason why we follow up our patients every 6 weeks, is because we want to constantly be communicating that you can't just stop eating less crappy food and lose weight. That is not
Right.
the end goal. The end goal is to change habits and eat an anti-inflammatory diet. It all works together. And I too have seen significant reduction in joint pains. I've seen probably one of the most remarkable is the significant reduction in neurodegenerative issues. That means less anxiety, less mental fog, and we don't know what the main prepatus for all of that is. Certainly, there's some anti-inflammatory effects that the GLPs have, but also I wonder how much of it is from the natural anti-inflammatory effects of not being insulin resistant. Insulin resistant is a huge driving force for inflammation. So when we get back, I really want to focus on those other things we do in our practice and be very specific and detailed about it to help as many people as we can out there. So we will be back in just a second. But before we leave, thank you so much to Dark Bags for giving us these amazing beanies. I actually wear it all the time, so I'm going to keep mine on the rest of this show. And we will be right back and catch up right where we left off.